So I have seen my patients in the hospital. All of the family medicine residency patients we follow in the hospital. The coordinator in the hospital knows to call us first when they are in the emergency department, and we go and we perform the admission for them and we follow them. We know all of their history already from the clinic, and it's great continuity of care to pick them up in the hospital, and they're always happy to see us.
In the hospital, it's really a great experience since we're the only residents available or around in the city. We kind of have first dibs on most anything that's going on in the hospital, whether that's specialists for learning points or procedures or anything like that.
Yeah, so being on the inpatient side, I think is like the most important thing you could be doing in family medicine. Seeing the really sick people helps prepare you for those just routine clinical patients, and the more pathology you can pack into that 3 years that you're in training is going to prepare you for the next 40 years of your career. So I encourage people, even if you are not looking to be someone who does hospital medicine in their career, to look at programs that are strong on their hospital medicine if you're going into any primary care, because that's where you're going to get the best training and the best preparation for those future years.
I have had several patients that we picked up that didn't have a PCP in the hospital, and after I was done taking care of them in the hospital on discharge, they asked, "Can I see you outside of the hospital?" And I was like, "Yes, I do. I have this clinic, the family medicine residency clinic right across town, and I can see you in clinic." So
the best part of being a third year is our elective rotations and getting that one-on-one access to specialists. Our specialists here are phenomenal. They are all really willing to teach, and if you have a particular interest, they will kind of take you under their wing.
Well, I really can't say enough good things about the specialists here at Monument. One of my mentors here, Dr. Heather Moline, has been like really awesome and instrumental in getting me where I am in this process, and like interviewing for fellowships right now. So I can't say enough good things about her.
With Monument being part of the Mayo Clinic network, sometimes with labs or specialists that are very, very subspecialized, we have access to them in the sense of sending referrals out there.
we have a great sports medicine program here at Orthopedic Specialty Hospital down the road. We have Dr. Harper, who's actually a graduate of the program here, and he is fantastic. So fun to be around, great to learn from. He's fantastic at ultrasound and all of his ultrasound guided injections, unless you participate as able. And those learning his physical exam is extremely helpful. Currently I'm on cardiology rotation. I'm with Dr. Pradhan, and he's been one of my favorite attendings. He's hilarious. I think he's just got my kind of dry sense of humor, and it took me a second to get used to because he keeps such a straight face when he talks to me, but he makes me laugh every day, and he's also very good at teaching. All of my experiences with the attendings have been like that though. They've all been very good, very open to having us rotate with them, and very good at teaching and very helpful and available for us.
The program offers the opportunity to get the training that you need while in residency in a multitude of areas, inpatient, hospitalist type work, emergency department, urgent care, outpatient, but then really there's places within Monument Health or other healthcare systems in the area where you can actually go and perform those duties, and that's something that is really advocated here, is that the family practice doc can really go and do all those things.